Welcome to Medical Marijuana and Wellness. Today's topic is easing anxiety and stress and how medical cannabis, medical marijuana can help. Helping me today with this presentation is Amy Green. Amy, welcome.
Yeah, always wonderful to be here, Mark. Thank you.
Listen, as a nurse working in a clinic, you see anxiety and stress quite a bit, don't you?
We certainly do. A lot of patients are coming in to treat their panic disorder, generalized anxiety disorder, other stress-related conditions.
So what's the
And
difference between stress and anxiety?
yeah, so stress is our body's physical and mental response to to an external stimuli. So something is happening outside of our body, and stress is our reaction to that input. Anxiety, on the other hand, it's an ongoing, escalated stress response to that external stimuli.
Yeah, and everybody really reacts to situations differently. There's a real difference between the way stress is triggered and anxiety is triggered.
Certainly. Yeah. So stress, again, it's going to be a physical and mental response to an external stimuli, and it can cause symptoms like headaches, high blood pressure, chest pain, heart palpitations, skin rashes, or a loss of sleep. And then things like fear or small amounts of stress can serve as a motivation and aid in self-preservation. That can be called eustress. However, most stress that people suffer from is distress or negative stress.
Right.
And some of that negative stress can then cause anxiety, which is an ongoing escalated response to the stress. Generally, anxiety is going to be characterized by a persistent feeling of dread or apprehension. Now, anxiety for some people can be caused by genetics or brain chemistry or even life events. It's a very complex condition. It actually does affect a lot of people in the world. You know, there's over 260 million people in the world that have an anxiety disorder. And it's estimated that almost a third of Americans will experience anxiety in their lifetime.
I think that's important because I think if you have anxiety or stress, it's important to understand you're not alone. A lot of people go through this, and it's a very natural reaction to a lot of things. So let's talk about cannabis for a second. What does cannabis equal?
Sure. So the cannabis plant is made up of a lot of different parts. You have your cannabinoids, your terpenes, and your flavonoids. Now, the cannabinoids, these are what people are very familiar with, your THC and your CBD, along with a lot of minor cannabinoids. And then you also have your terpenes. Now, terpenes are what give cannabis its smell and its taste, but they can also bring a lot of really helpful benefits. And then you have flavonoids also contributing to smell and taste and the aroma of the flower. Flavonoids also can have some really powerful benefits, like being an antioxidant, anti inflammatory, and possibly helping with disease prevention.
Sure. Now, working together produces something called the entourage effect, and this is really important.
It really is. So when we think about the cannabis plant, we're thinking about all of these parts together. So when we combine cannabinoids, terpenes, and flavonoids together, we're really getting that entourage effect where all of the parts are working together to bring our body into a state of homeostasis or balance.
And this is really the magic to cannabis, really those components working together to provide the medical benefits that we're really looking for. Now, how does it provide the medical benefits?
Sure. So our body has a system called the endocannabinoid system. Every single person has one, and all of our endocannabinoid systems are a little bit different. So what our endocannabinoid system is it's a series of receptors throughout the body that are helping and modulating pain responses, anxiety, memory, appetite, anti-inflammatory, and even immune system responses. The cannabinoids that our body naturally produces are called endocannabinoids, endo meaning inside. And when we use something like a cannabis plant or any cannabis based medications, we are introducing phytocannabinoids. And so we are introducing more cannabinoids into our endocannabinoid system and supplementing our naturally occurring system.
And it's
I
interesting that these phytocannabinoids really mimic and almost they're exact copies of the endocannabinoids.
And they are. It's our body is producing a cannabinoid that is identical to what is naturally occurring in the world. So when we are supplementing with the cannabis plant, we are introducing pretty much exact copies of our endocannabinoids into our body in the form of phytocannabinoids. So just phyto meaning from the cannabis plant.
And I think this is important to understand, especially as we get older, senior citizens like myself. we don't produce a number of endocannabinoids and as quickly as we can to certain situations. So having phytocannabinoids in our body, in essence, is charging that battery. It's making sure your body has the natural components that it needs to keep your body in balance or keep your body in homeostasis. Let's talk a little bit about what the researchers are saying, because there's some very positive research related to how cannabis can help with anxiety and stress.
Absolutely. So we know that the endocannabinoid system plays a really important part in regulating our body's response to anxiety, fear, stress. And that is how our body modulates stressful stimuli. Individuals suffering from PTS and or chronic pain have reported that they've had a reduction in anxiety related symptoms when they're using cannabinoids or the medical cannabis plant. And it's been shown to be very helpful and beneficial to them. Now, many of the terpenes in the cannabis plant actually boost its anti-anxiety effects. These are terpenes like linalool, limonene, beta-caryophyllene, and we still have researchers that are doing lots of research on individual cannabinoids and terpenes and looking at how they are affecting the body. Now,
And those that research is really important because those terpenes really help our body not only heal itself, but it also brings it the reason why cannabis is so important to us. Now, also, there's a study that was done in January of 2020 about 2-AG. This is a very important one.
yeah, it found that 2-AG, by activating the same receptors as THC, was helpful in reducing anxiety-induced connections between the amygdala and the frontal cortex, which are parts of your brain that are responding to that stimuli.
Yeah, this is where a lot of your appetite, mood, pain relief, this is where a lot of that comes from. And this is really an important factor. This is important finding that they're finding out that it really endocannabinoids are something that not only help control our body, but really are something that keeps us not only balanced, but it's very important for the bodily function. Let's talk a little bit about cannabis itself, Delta 9 and CBD. These are the main components of cannabis. Of course, there are 120 different cannabinoids, but these are the two main ones that we hear about.
Yeah, so again, when you think of the cannabis plant, most people are thinking of THC or CBD. The biggest difference between these two, THC has the ability to produce psychoactive effects, and CBD does not produce psychoactive effects. THC in high doses can be anxiety inducing, whereas low doses of THC can ease anxiety and aid in relaxation. And that's really, really important for people that have an anxiety disorder to remember. If they are starting with a THC containing product, they want to start at a very low dose and gradually work up to a dose that's effective, but without unwanted side effects. In this case, the unwanted side effect would be anxiety caused by a high dose of THC. Now, when we look at CBD, both high and low doses of CBD appear to help reduce anxiety. So CBD, because it's not producing those psychoactive effects, has a much wider range of actual use and dosages that can be beneficial.
Sure. And THC, we talk about cannabis being what they call biphasic. In other words, you take it as you're starting to take cannabis, you start low, you go slow. You'll start finding that after a day or two, you'll be getting some relief. Then all of a sudden, you get to a point where it's really providing the relief you want. And then as you take more, it may actually cause the anxiety and stress to come back. So you have to go back to that level. In other words, go back to where you are, because again, you want to make sure that it's helping with your anxiety and stress. Staying with low doses helps that. But if you use too much of that, it could bring it on. And that's what we don't want to have happen. We want to be able to relieve your anxiety and your stress. And again, being very careful to go low and go slow is important. Is that correct?
That is absolutely correct. Again, we want to help find the minimum effective dose to have the relief that you're looking for without unwanted side effects.
Right. So, and that's more important. One of the most important things to understand is cannabis is safe. There's been no reported fatal overdoses, both recreational cannabis as well as medical cannabis, from using the product. This is an important part because unlike opioids or heroin or even tobacco, this is a safe product.
Certainly. And especially when you're talking about stress and anxiety, a lot of people are very familiar with benzodiazepines, such as Xanax or Valium. Those medications are actually highly addictive, and they have a very narrow therapeutic dose, meaning that it's possible for patients to take too much of that and to have a very negative or even potentially fatal reaction to those medications.
Yeah, and this is an important report from the World Health Organization, really showing the safety of being able to use cannabis. But the magic cannabis is really the terpenes. There's a number of terpenes that really help with anxiety and stress.
There really are, and there's obviously a lot of terpenes here. I'm just going to touch on a couple of them. One of them, linalool, is really great for stress and anxiety relief, but it's also a mood booster. So if it's lowering your anxiety and bringing your mood up, it's kind of helping you on two fronts there. Same thing with linalool. It's going to help with stress and anxiety. It's also a mood booster, but it can be sedative as well. So if a patient needs something to help them relax and maybe get to sleep, something like linalool or myrcene even can be very, very beneficial. And again, when you look at beta carotene, this is a stress and anxiety reliever, and it can also have antidepressant properties. So patients may find that it's helping their anxiety, but it may also be helping their depression as well.
Sure. So when you're going to a dispensary and you're looking for a product that can help with cannabis, mention limonene, linalool, myrcene, and caryophyllene. These are products that are actually terpenes that can help you, and your bud tenders can actually find the products that they have to have those components in there to help you quite a bit. Now, one of the other questions that comes up that a lot of people ask me is, how do I take it? Because a lot of people have the perception that smoking is the only way you can use cannabis, but we have a lot more routes of administration or ways of being able to use it than that.
Yeah, we really do. Smoking or inhalation products are just one of many choices. And especially for newer patients, we actually recommend products like the sublingual drops, also known as tinctures, or even the edibles. Those are generally products that we would have patients start with because they're very easy to dose. It's very easy to slowly increase your dose, and it's very easy to just handle the product. So you don't have to do a lot of manipulation or set anything up or get anything ready. It's right there and you can take it. So
Yeah.
very easy for a new patient to use. Now,
One of the
products,
things about routes of about some legal drops is they tend to work and they start within 15 to 20 minutes and last 4 to 6 hours. But edibles, that's a different game. They can start working maybe in 15 minutes, but most of them take about 2 hours. When you're doing edibles, you really got to be cool because just about the time you think they're not working and you take another one is when they start working. Is that correct?
that is 100% correct. Yeah. And it's as soon as you don't think it's working and you took that other one, that's when you start feeling it, because that's how it always happens. Now, additionally, products like inhalation or flower, so vapes or using smokable flower, can be helpful for patients with anxiety. But again, you have to use a very low dose of THC containing products, or there's a higher chance of having that reflex symptom of anxiety by using too much THC.
So the bottom line also is when you're looking at terpenes, terpenes are very sensitive to temperature. And I know that if you're taking it, for example, as a tincture or as a gummy, you don't have to worry about this. But if you're vaping, you do have to worry about the actual temperature. And most vape pens have a temperature setting, a low, medium, and high. Tell us about that.
Yeah, absolutely. So we would generally recommend starting at the lowest possible setting. It's going to be the best for getting a wide range of terpenes in the product. And it's also going to have the best kind of flavor of the plant. Lower temperatures can also be a little bit easier on your throat and your lungs if you do find that you have any irritation. Now, once you start moving up in temperature, though, you kind of open up some other terpenes that might not be available at lower temperatures. So you might move from a low heat to a medium heat if you find that the low heat wasn't effective. But once you start getting into high heat, you're going to have very intense effects from the product. And that, again, can put you at that point where you're uncomfortable or you have negative side effects.
Sure. And this is where we're recommending using either a vape pen that has a temperature setting on it and or a dryer vaporizer if you're going to if you do want to smoke cannabis. I think lighting up that joint or that blunt, putting that 500-degree temperature to that paper is something that'll burn off a lot of the terpenes, a lot of the cannabinoids. Dryer vaporizers work with steam and don't necessarily work with burnt material.
Yeah, and so it can be a lot easier on your lungs when you're not having that byproduct of combustion from actually smoking a joint or using a bong or something like that.
So, Amy, what's the bottom line? I know that cannabis is safe, and I think that's really important, but there's other some key components here.
Yeah, the biggest thing with medical cannabis, there is zero chance of overdose. Say, for example, a patient accidentally eats that entire medicated chocolate bar because it was very delicious. They're going to have several hours of being very tired, very hungry, or having a stoned, heady feeling. All of those things go away with time with no lasting symptoms or side effects or anything. The other big thing is medical marijuana is completely based on how the patient feels using the product. What that means is that they are in control of their dosing. If it doesn't feel like it's enough, they can take a little bit more. If it feels like it's too much, take a little bit less next time. It's entirely based on how you feel using the products. Additionally, medical cannabis has not been shown to be addictive. So there's no addictive properties, unlike opioids, heroin, tobacco, cocaine, nicotine, caffeine, any of those. And you do not need to smoke medical cannabis. There are so many different routes of administration, including edibles, capsules, sublingual tinctures, transdermal patches, and topicals. There's so many different ways that patients can use cannabis now that don't involve inhaling a product at all.
Yeah, and this is really important because it a lot of folks are concerned about any medications. I know you look at a prescription bottle, and most of them will tell you that if you take too much of it, it'll kill you. That's not the case with cannabis. And more importantly, what's really key about cannabis is you can't get addicted to it. And I think that's provides the safety factor that's there. And you don't necessarily need to smoke it. We talked about the different routes of administration. You can have, again, it's a personalized product. You can use it the way you feel comfortable using it. So, Amy, what resources do we have out there for folks to be able to, first of all, let's start with getting your card.
Certainly. So, medical marijuana treatment clinics of Florida, we have over 25 clinics throughout Florida, and we are staffed by highly trained doctors, nurses, and patient educators. That we are just here to help patients on their medical marijuana treatment journey.
I think that's important that they're there. And also, you do a lot of dosing support, which really separates MMTC from other doctors' clinics that are out there. If you're looking for cannabis products, recommend AYR. AYR does a great job of providing quality cannabis products that are tested not only twice by themselves, but also once with an outside third party firm, and has a very good handle on a number of terpenes. In fact, you can ask them when you go in to talk to them, do you have terpenes? And of course, they'll show you what terpenes are in the product that you're looking for and give you recommended products for the terpenes you're looking for. And last but not least, if you're looking for patient education, the YouTube channel, Marijuana Aware, YouTube at Marijuana Aware provides a lot of information on getting started, how medical cannabis can help with different situations like anxiety and stress, and also the webinars that are out there. You can watch those as well as the questions and answers that come from them. So any final comments, Amy?
As always, please dose responsibly, start low, go slow. Remember, you can always take more, you just can't take less than you've already taken.
Sure. And cannabis is a safe medication for anxiety and stress. Thank you very much for joining us.